Have you ever wondered how heroin, a drug now synonymous with addiction and destruction, came into existence? Let's take a step back into the 19th century. It was a time of innovation and discovery, and in the midst of it all, a German pharmaceutical company known as Bayer was making waves. They unveiled a new drug, a substance they hailed as a miracle cure. They named it heroin. Heroin was initially marketed as a cough suppressant, which was certainly a boon during a time when tuberculosis was rampantly claiming lives. But what really made headlines was its supposed non-addictive properties, positioning it as the perfect substitute for morphine. Yes, you heard that right, non-addictive. It's hard to imagine now, given what we know about the devastatingly addictive nature of heroin. But back then, it was a revelation. That is, until the truth about its addictive properties came to light. So, what started as a miracle cure quickly became a public health nightmare. How did heroin transform from a medical marvel to a street drug? This shift began in the 20th century when the US government declared heroin as illegal. It was a decision made to protect the public, but it inadvertently pushed the drug underground. The Vietnam War era saw a significant rise in heroin use among soldiers overseas. Cheap and easily accessible, it became a temporary escape from the harsh realities of war. Upon their return home, many brought their addiction with them, spreading its use across the country. Fast forward to the 80s and 90s, heroin seeped into the suburbs. With a new market and higher demand, dealers capitalized, leading to a surge in drug-related crimes and a devastating impact on communities. The story of heroin is a study in unforeseen consequences. Its banishment from the medical field, intended to protect, only fueled its descent into the underworld. Heroin's transformation from a miracle cure to a banned substance resulted in an unexpected and dangerous shift to the black market. What is the current status of heroin in our society today? Well, it's a grim picture to say the least. Heroin is now at the epicenter of a global opioid epidemic. In the United States alone, the crisis has taken a severe toll, with a staggering increase in overdose deaths over the past decade. But the heroin we're talking about today isn't the same as it was years ago. It's often cut with substances like fentanyl, a synthetic opioid that's 50 times more potent than heroin itself. This lethal addition has exacerbated the death toll, making an already dangerous substance even more deadly. Yet, amidst the bleakness, there are glimmers of hope. Efforts are underway to combat this crisis, from harm reduction strategies like needle exchange programs and supervised injection sites, to comprehensive treatment programs offering medical, psychological, and social support. From a miracle drug to a deadly street substance, the journey of heroin through history is a stark reminder of the complexities of drug use and abuse.